Vitamin B6, also known as pyridoxine, is one of the 9 water-soluble vitamins. It's used as a coenzyme in more than 100 enzyme reactions. It's also used for protein, amino acid, and other metabolism. It also helps the immune system by promoting the production of lymphocytes, hemoglobin, and interleukin-2. The top 5 food sources of vitamin B6 are 1 cup of canned chickpeas, which give 1.1 milligram per serving, or 65% of the daily value, 3 ounces of pan-fried beef liver, or 3 ounces of fresh cooked yellowfin tuna, which both give 0.9 milligrams per serving, or 53% of the daily value, 3 ounces of cooked sockeye salmon, which contains 0.6 milligrams per serving, or 35% of the daily value, and 3 ounces of roasted chicken breast, which contain 0.5 milligrams per serving, or 25% of the daily value. The RDA of vitamin B6 for males is 1.3 milligrams a day from ages 14 through 50, and 1.7 milligrams a day for those above 50. The RDA for females is 1.2 milligrams a day for those aged 14 through 18, and goes up to 1.3 milligrams a day from 19 through 50, and 1.5 milligrams a day for the females above 50. For females that are pregnant, the RDA is 1.9 milligrams a day, and the RDA is 2 milligrams a day when they're lactating.
Meeting the recommended daily amount of vitamin B6 is typically not difficult for people who eat a well-rounded diet. In the United States, most adults reach their dietary vitamin B6 needs from fortified cereals, beef, poultry, starchy vegetables, and fish. The bioavailability for vitamin B6 is about 75%. So, for example, eating a serving of chicken breast, a half a cup of squash, a serving of fortified cereal, and a banana would reach the recommended daily amount of vitamin B6 for most healthy adults. Here we have a visual representation of just some of the possible foods you can eat to achieve your recommended daily amount of vitamin B6. A UL value is the maximum amount of a vitamin that you can safely consume without putting yourself at risk of an overdose or serious side effects. The UL value for vitamin B6 is about 100 milligrams for most adults. Eating 100 milligrams of vitamin B6 would be like eating 90 cups of chickpeas or 250 bananas. The UL value for vitamin B6 is much higher than the recommended daily amount. If for whatever reason it was your goal to get 100 milligrams of vitamin B6 a day, you would likely need to be taking supplements to reach that value. Since vitamin B6 is a water-soluble vitamin, smaller quantities of unused amounts will not be absorbed and will exit the body through the urine. Although a toxic level of vitamin B6 can occur from taking high doses of supplements over a long course of time. A vitamin B6 deficiency is uncommon among healthy adults. The most common causes are due to autoimmune disease, renal failure, or alcohol dependence. Individuals with a medical history of chronic alcohol abuse have been shown to exhibit lower levels of the coenzyme form of vitamin B6 called PLP. This is likely because the liver is the primary source of this coenzyme, and it is also the main organ that processes alcohol. Individuals with malabsorptive autoimmune disorders such as celiac disease, Crohn's disease, and ulcerative colitis can be at higher risk of having a vitamin B6 deficiency. Additionally, patients with kidney disease often show clinical symptoms similar to those of people with vitamin B6 deficiencies. Researchers suspect this is due to a problem with how vitamin B6 is metabolized in patients with renal failure.
3 major effects of deficiency in vitamin B6 are weakened immune function, depression and confusion, and microcytic anemia. Low B6 is associated with the deficiency in other B-complex vitamins such as B12 and folic acid. Microcytic anemia is a combination of issues. Microcytosis is when one's blood cells are smaller than normal, and anemia is when you have fewer functioning blood cells. So the combination leads to smaller and fewer functioning blood cells. 3 common reasons for toxicity are interactions with medications, dietary supplements taken at high doses for 1 to 2 months, and gene mutation. Some medications can lead to low PLP concentrations, the active metabolite for B6, resulting in CNS issues. High doses of vitamin B6 taken through supplements is the most common means of toxicity, as it is used to treat things like morning sickness. And with respect to the gene mutation, the MTHFR gene, that doesn't allow for vitamin B6 to enter cells, but the concentration of the vitamin is high in the blood. 3 effects of toxicity in the body are difficulty walking, tingling in the extremities, and ataxia. Individuals taking as little as 200 milligrams to 6 grams of B6 daily for 2 months experience difficulty walking and tingling in their extremities. ATAXIA is a disease of the nervous system caused by damage to their cerebellum, and it mimics being drunk, with symptoms like slurred speech, stumbling, falling, and an inability to coordinate. And this can result from taking 1 to 6 grams of oral pyridoxine for 12 to 14 months every day.
Different forms of vitamin B6. Vitamin B6 is the generic name for 6 compounds with vitamin B6 activity: pyridoxine, an alcohol, pyridoxal, an aldehyde, and pyridoxamine, which contains an amino group, and a respective 5-phosphate esters. Pyridoxal 5-phosphate, PLP, and pyridoxamine 5-phosphate, PMP, are the active coenzyme forms of vitamin B6. All forms of vitamin B6 are absorbed by the small intestine by passive diffusion. The vitamins attach to albumin and are brought to the liver. The liver adds a phosphate group which converts vitamin B6 to pyridoxal phosphate, which activates it. This active form is stored attached to enzymes in the muscle and smaller amounts in the liver, brain, kidneys, and spleen. Pertinent interactions with other vitamins, minerals, or compounds in foods. Vitamin B6 has interactions with chemotherapy drugs, barbiturates, anticonvulsants, and drugs used to treat Parkinson's disease. There are no other pertinent interactions of vitamin B6 with other vitamins, minerals, or compounds in foods. The history of vitamin B6. In the 1930s, Rudolf Peters showed that young rats kept on a semi-synthetic diet and no other supplement developed rat acrodynia, characterized by severe cutaneous lesions. In 1934, Paul Georgi showed that vitamin B6 cured rat acrodynia. Studies showed that vitamin B6 deficiency produced convulsions in rats, pigs, and dogs. Samuel Lobkowski isolated and crystallized vitamin B6 in 1938. Further studies showed that the 3 main forms of vitamin B6 have largely equal activity in animals due to the organism's ability to convert them into the active form. It plays a role in enzyme systems, especially in the metabolic utilization and transformation of amino acids.
Vitamin B6. It has 2 active forms known as PLP and PMP. These are both responsible for helping other enzymes catalyze around 100 metabolic reactions or more. PLP specifically is used as a coenzyme for releasing glucose from glycogen or to generate glucose from amino acids. PLP-dependent enzymes are present in the brain for creating the following neurotransmitters: serotonin, dopamine, and GABA. Both low serotonin and dopamine levels can lead to depression. Serotonin specifically helps regulate sleep, memory, and digestion. Therefore, without vitamin B6 acting as a coenzyme to create these neurotransmitters, it can affect a person's mood, appetite, sleep, and thinking. Because of the effect that vitamin B6 deficiency has, there is a huge market for selling, quote, happy pills or mood pills that are essentially just a large percentage of vitamin B6. There is even a brand that targets women by promoting anti-PMS pills that are just usually vitamin B6. Digestion and absorption of vitamin B6. As vitamin B6 is found in a large amount of foods high in protein, it must be released through the digestion of protein. After being broken down from the protein source it often comes with, it is then a water-soluble vitamin that can be absorbed through passive diffusion, within the small intestine. It actually has a very high absorption rate and is easily taken in by the body. And the part of the small intestine that absorbs this vitamin is the jejunum. Some recent research on vitamin B6 shows that pregnant and lactating women are often deficient in it, which therefore causes their offspring to be deficient. As a result, there is usually some problems with cognitive development for these offspring because of its role in developing the nervous system.